Good afternoon, everyone. My name is Mary Krinkie, and I'm the Vice President of Government Relations here at the Minnesota Hospital Association. And I'm really excited to share a little bit of information on where we're at with the legislative session that is obviously now in progress. So every 10 years, we go through this process called redistricting, and it makes things very complicated at the Capitol because all the legislators are very nervous about what is happening out in their districts and how the district lines are being changed. So this year it was particularly controversial because we had a number of legislative pairings. In the state Senate, there were 10 state senators that were paired against another state senator, sometimes from the same political party and sometimes from the other political party. And there were 18 legislative House members that were paired in the same district. So far this year, we've already had 42 legislators that have announced they're going to retire. And this is out of 201 legislators. So I just think it's important for us to recognize, as part of our outreach and as part of our advocacy efforts, that next year at the state capitol, we are likely to have at least 25% of our legislators will be new. So it's really important that we try to build good relationships with those legislators and get to know some of the candidates. And we'll be talking more about that this summer and fall. So what's happening right now at the Capitol? Well, today is April 1st, and this is the day known as the second committee deadline. And so all policy bills have to have passed in all of the bodies, both the House and the Senate, if they are still considered to be viable to move forward in the legislative process. Now, what makes this really not really a rule, if I can say that, is because of these big omnibus bills. So what will happen is the Senate will move some bills forward in their omnibus, and then the House will move some bills forward in their omnibus, and then they go to conference committee to try to work out the differences. So what is MHA working on? Well, this year, most of our work has been focused on either workforce efforts or mental health efforts. And I want to share with you some of the information from our workforce agenda. We are tracking 6 different bills right now that involve workforce. And I'm going to mention 3 bills that do not involve any money, and then 3 bills that do involve money, all in the workforce area. So the first one I want to mention that does not involve money is a bill that we've been working on for a couple years now regarding streamlining the fingerprinting process. Now, boy, that sounds strange. What is fingerprinting? What is streamlining fingerprinting? What does all that mean? Well, right now, if you are a healthcare professional, a doctor or a nurse, you have to get a fingerprint and background check done when you go to get your professional license. And then when you get a job at a healthcare facility, you have to get a second background and fingerprint done. And so what happens is it just slows down the entire process. And it's really frustrating for these individuals, some of which are new graduates from school. They've graduated, they get their background check, and they want to start working, and then they have to get another one scheduled. So we've been working on that bill to get it down to 1. Our slogan is 1 and done. The second bill that I want to mention is a bill to try to speed up things at the Board of Nursing and the Board of Medical Practices. We know with workforce, we just have to get people into jobs more quickly. And we have a bill regarding creating temporary permits for 4 categories of employees: physicians, physician assistants, respiratory therapists, and nurses, where they could start working if they were from another state and duly licensed. So this is bringing in more folks from around other states to come into Minnesota. They could work in Minnesota for up to 90 days if they have a temporary permit. Now, we already have in place for nurses a 60-day temporary permit, and that was really, really helpful during COVID. We were able to bring in other nurses from other states, and they could start working for 60 days while they were applying for their license. But we don't have that for the other healthcare professions. So we're trying to get it consistent for those 4 categories to be able to have a temporary permit so we can bring in new people from other states and they can start working in Minnesota. Similarly, there's another bill that's moving in the Senate regarding the Nurse Licensure Compact. And the Nurse Licensure Compact now is something that is in 37 states around the country. And this enables a nurse to work in Minnesota if they're duly licensed, but they could also work in another state if they were part of the compact. And similarly, we could bring in nurses from other states if they were duly licensed in their home state, if Minnesota chose to join the compact. Right now, Minnesota is not part of that Nurse Licensure Compact. I want to mention a couple other bills that we're working on that do cost money. The frontline worker pay. This is a bill from last year that would provide a bonus to those healthcare workers and other frontline workers who throughout COVID came to work. They helped us get through the pandemic. And there's been a bill at the Capitol to give as much as $1,500 or $1,000 to those frontline workers. We are working hard to see that our healthcare workers are included in that and that we can still get this done. MHA is also working on a new scholarship bill for 4 categories of healthcare employees. And those 4 categories are laboratory professionals, both the 4-year and the 2-year, respiratory therapists, rad techs, and surgical techs. And we're working on a bill to try to get 1,000 scholarships of $5,000 each. And we're calling this bill our Allied Health Professionals, getting them into the workforce, 1,000 new allied health professionals, if we can pull that off. So we have a chart here that shows how the growth and how many new employees we're going to need. And it's really important that you can see there the numbers. It's really important that we try to get some new people in the workforce in those jobs, because we are going to have some severe shortages of those 4 categories. If you look at the blue line, that's laboratory professionals. We are going to have some shortages going out into the future. And the last bill that I just want to mention on the workforce issue is there's a bill in the tax committee to provide what's known as a preceptor. And this is up to a $5,000 tax credit for anybody who's willing to help train new professionals. And that is if they do so for 480 hours in the taxable year. I want to move on to a couple mental health bills that we are following. These are in the governor's budget, and we believe they will be in the House Health and Human Services Omnibus bill. One would provide up to $20 million for bonuses and for retention grants for folks working in mental health jobs. And we know that we need to keep and retain our mental health professionals. So this is something we are supporting in the governor's budget bill. And the other item is $10 million for new beds for pediatric, adolescents, and inpatient services, and also to help grow our pediatric residential treatment facilities, the PRTFs. So this has been very important. It's important to have mental health services that also have a housing component. I want to spend my last couple minutes with folks today talking about a bill that we're opposed to and something where we could really use your help. This is the nurse staffing ratio bill that has been pushed at the Capitol now for over 10 years by the Minnesota Nurses Union, the MNA. And the bill is really a difficult bill. It would require every hospital to have a staffing committee, and the staffing committee would have to be comprised of 60% union membership if the hospital has a collective bargaining agreement. And that committee would get to decide the staffing ratios for the entire hospital. And the hospital, according to the bill, must follow the staffing plan created by the union-controlled staffing committee. The bill goes so far as to say that if you violate the staffing plan, the hospital would have 3 different strikes, and the potential is there for the Commissioner of Health to potentially pull the hospital license if they violate the staffing agreement more than 3 times. So there's a lot of concerns with this bill, but I just want to reiterate here that we know that hospitals, of course, would try to abide by the law, and they would refuse admissions, and people would back up in the emergency rooms. It would be a real mess. It also just doesn't pay enough attention to our care teams and all the folks that are engaged in providing care to patients. While obviously nurses are extremely important in patient care, it really is about our entire care teams. I'd like to urge you all to please to talk to your legislators about this bill. We know how important advocacy is. And I just want to say in closing,
that our trustees, you all are the respected voices in your communities. And that's why you became trustees and you're looked up to. And I just want you all to know, I think that if legislators hear from you, it will make a big difference. They're at a really, really difficult time now in the legislative session. Maybe you could write them an email or a little note that just says, hang in there, keep up the good work, try to get some good things done before the clock runs out. Maybe we could get some of our workforce initiatives funded and urge them to please be opposed to this nurse staffing ratio bill. It would dramatically change how hospitals operate and how we're able to deliver care for patients. So thank you, and please feel free to reach out to me if I can provide some additional information for you. Thank you.